So let's walk through an example of kind of a completed chain of transmission. So we've got the infectious agent here would be methicillin-resistant Staph aureus, or MRSA. The reservoir would be one of the residents' skin is colonized. They don't have active infection that we talked about colonization earlier. There's got to be a way for that Staph aureus or the MRSA to leave that one resident. So let's say they have an open draining wound on resident A would be a good example. They have a Staph aureus skin infection. It was cultured and it showed methicillin-resistant Staph aureus was present in that draining wound. A healthcare worker such as you or I came in to take care of resident A, took care of the wound itself, and after doing that we forgot to do good hand hygiene, such as putting on alcohol-based hand rubbing our hands to prevent that contamination on our hands. And we went immediately to another resident and they needed help with their urinary catheter, would be one of those examples. So what we've done is we've touched that urinary catheter or somehow manipulated that device and inoculated it with MRSA on the catheter itself. Over time, say a day or two later, that MRSA begins to migrate up along the catheter surface and actually get into the patient's bladder. So that would be the mode of entry for the next resident, which would be resident B. And then finally, because they have an indwelling urinary catheter, that sets up a risk for coming down with urinary tract infection from the catheter itself. And then the final step here would be the resident B actually develops a MRSA UTI from that same strain that came from resident A. So this would be a dramatic example of direct kind of transmission from resident to resident, but I think it gives you a good picture of kind of how all these links in the chain of transmission could come together and result in a urinary tract infection, say in that second resident. So how do we break this chain? I think that's the key piece that we're asking you as part of the study to really help us focus in on how can we prevent transmission of especially multi-drug resistant organisms, but for all organisms, whether they're susceptible bacteria or resistant. We want to stop this movement of the microbe or the bacteria from one individual to the next. So for this example we just talked about, one area where we might break this chain would be the exit, so it's leaving that one resident A. So if we had good containment of that skin drainage on resident A, we may be able to prevent contamination of our hands, but also maybe the environment. So that would be an example of one place we could break this chain of transmission. Certainly the most important thing, and if you've heard this I'm sure at your facility, best way to interrupt transmission is good hand hygiene. No matter what the resident that we take care of before the next resident, if we use good hand hygiene, we're going to stop that transmission from one resident to the next. So usually with alcohol-based hand rubs, very convenient. It's probably the most effective way to do hand hygiene and the most efficient in terms of time. So some good principles. We'll be talking later in some modules about standard precautions and hand hygiene to really break this train of transmission, but we're focused really on this piece of the link, the mode of transmission. Another thought, looking at the resident, can we change that resident's risk of coming down or exposing them to bacteria or germs? And one way, if they have an indwelling urinary catheter, as you see here, if we remove that catheter, we minimize or lessen the risk of subsequent infection in that patient. So getting that device out when it's no longer needed, if possible, that's going to be an important way, again, another link in this transmission where we can actually break this, one of the chains here and prevent that movement of the MRSA infection from one patient to the next. So I want to thank you for your time this afternoon or this morning, depending on when you're listening to this. We have a live moderator with you to follow up on some questions and answers. And as I mentioned, our next module that we'll be talking about focuses on standard precautions and hand hygiene. Thank you very much and appreciate your efforts in infection prevention.